You were here this morning to give us to talk a little bit about the stigma of mental health and the issues surrounding mental health. And this time of year, we see a lot of that.
That's correct.
Kind of give us a little primer on that.
Sure. So, mental illness is an important topic to talk about as any topic. And that there's a lot of people that suffer with mental illness. And in fact, in 2020, 1 in 4 Americans, adult Americans, will have a diagnosable mental illness. So we hear at this time of year, especially about holiday blues, holiday stress. Even at times there's been Christmas songs written about depression at the holidays. Mm-hmm. But depression, for some people, is not just at the holidays, it's every day.
Yeah.
And unlike other illnesses, oftentimes people see mental health issues. And when I say that, we could talk about depression, anxiety. Some of the more serious are called schizophrenia. There's bipolar disorder. And certainly we hear a lot about substance use disorders, and especially in the last several years, the opioid use epidemic. And 1 in 4 people suffer from one of those illnesses. Mm-hmm. Yet we don't really talk too much about that. Now, in the last several years, we have had some success in what I would call destigmatization, because there's been some celebrities, some well-known people come out and say that they were sufferers, and that helps. And then in a very sad way, there's been some rather horrific suicides of very well-known people over the last several years. Think back to Robin Williams and so many others.
Right,
some more recently, etc. And so I think maybe a little bit of the good that comes out of that, as bad as that is it gets people talking.
Yeah.
But, that old saying is talk is cheap. So it kind of is. So talking is the first step.
Right.
But really, we need to be embracing people to get the help that they need.
Why is there so much depression during the holidays?
It's just, think of, and you probably talk about social media and everything, and you think everybody's having a great life. Mm-hmm. Think of the famous movie, It's a Wonderful Life.
Right.
And you kind of think everybody's better off than you are. And so most of us, we can kind of put that into perspective, and we may get down. Also, with the holidays, there's so much focus on good things like family and loved ones, etc. But if you've experienced a loss, mm-hmm. if you've lost somebody this past year, etc., that can be very, very tough for any of us.
Yeah.
But most of us are able to kind of get through that. Mm-hmm. But there's some people that are truly depressed from a clinical perspective, and so they get a little bit stuck. Yeah. But it's not just at Christmas, Henry. It could be at any time of the year. So I kind of talking to my colleagues in regards to, you just had some people on that were giving money for people that are less fortunate. But there are less fortunate people 365 days a year.
Right, yeah, exactly.
So I think anything that we focus on Christmas, around the Christmas holiday time, gets elevated a little bit. But
can you give me some tips on, we all deal with coworkers, family members. Mental illness is touching just about everybody from some angle these days.
It touches everybody at some level.
So give me some, give us some tips on what to look for and things to be worried about when we see this in a coworker or a family member and that kind of thing.
So there's a couple ways to look at that. Is that people who are looking at struggling with depression or substance use issues because of the stigma, oftentimes tries to keep that under wrap. So that they don't want to share. So asking questions. And sometimes asking those tough questions actually is part of the healing process for somebody. Because if you see, I recently heard somebody talk about an experience where they were crying in the back of a bus, a city mm-hmm. bus, and this was not local, and everybody kind of ignored them, except for one person reached out.
Yeah.
And said, "Hey, are you okay?"
Right, yeah.
And just that little, "Hey, are you okay?"
Yeah.
Or would you like me to talk with me? Or those simple things. Henry, there's not one special word or one special sentence, but it's showing care. Mm-hmm. And I think at Christmas time we could talk about showing love and grace and mercy. And so that if people are willing to share that they have a problem, an issue, emotional, substance use, that's, some of us would say that's 50% on the way to recovery.
Yeah, right.
And the good news about mental illness and substance use, and there is good news, is it's often treatable rarely completely untreatable. There are some extenuating cases, and very often recoverable. But what happens is people see depression and substance use as not necessarily an illness that it is. They often see it as a weakness. They see it as a character flaw or a sin. And we know that mental illness is actually a disease. There's a biological connection to it. And I think some of the stigma, even though we're improving, still has a long way to go. And back 20, 30 years ago, at least in my personal experience, cancer was very stigmatized.
Yes.
And I'm not saying that it's still not stigmatized today to some degree, but my grandmother, when I was 12 years old, died of cancer. But nobody in her family ever used that word. It wasn't until years later that I knew why Grandma was sick.
No kidding.
And what happened. And in that culture, back then, it was tied to you've done something wrong. If you got cancer, some people would think it was your fault. And so mental illness is not the person's fault.
Right.
It's a disease,
great
and they
analogy.
need to get treated for that.
Great analogy. Glenn Simpson, Administrator for Behavioral Health at Vidant. As always, we have so many incredible resources in this community. What does Vidant offer for resources for mental health?
So we have basically throughout our system, we serve 29 counties. We do have a full continuum of care. So we have outpatient, and that's like psychiatric clinics, and we are partnered with ECU psychiatry. We offer structured outpatient programs, which are hospital-based, but not inpatient, and we also have inpatient, and some things kind of in between. And what we really ask people to do is, if it's hard to go say, I need to see a psychiatrist, go talk to your doctor. Because every doctor has some training in mental health, because mental health and physical health is all health. And the mind and the body, Henry, as you know, we're all connected together.
Right.
So the first step for somebody is they can often just say, hey, doc, I'm feeling a little down, and we do encourage providers to ask those questions. And as a country in healthcare, we're getting better at that we do some screenings and that sort of thing. And sometimes those questions are hard to ask. But if you don't ask somebody if they feel like killing themselves, you may not know.
Yeah.
And then we do know that most folks that kill themselves have been to a doctor within 30 days before the event.
Is that right?
Yeah.
Wow. That's kind of sobering, isn't it?
It is very sobering.
Good information. Is there a place people can learn more if they want to find out more about what's offered at Vidant, Glenn?
Yeah, so the best way is to our website, vidanthealth.com, and then there's a drop-down for programs and services, and there's a whole link for behavioral health. And in that link has all the information about the services that we provide, and some other resources as well.
Great. Thank you for coming.
Thank you.
Good
Appreciate
to see
being
you.
here.
Merry Christmas
Yeah,
to
Merry
you. Thank you
Christmas.
for being
Okay.
here.
Thank you all.
Glenn Simpson, the Administrator for Behavioral Health at Vidant Health. We appreciate you coming in.